I'm Dr. Tracey Koehlmoos from the Center for Control of Chronic Diseases in Bangladesh. We have many partners on this project, including developed country partners from Hopkins and the UK, but also all the allied institutions working in this field in Bangladesh. Believe it or not, chronic disease is killing more people than anything else in Bangladesh. So heart attacks, stroke, diabetes are bigger killers than causes of death like delivering your baby safely or childhood illnesses.
Right.
We have 4 separate programs of research that we're working on. 2 are looking at that link between chronic disease and what makes us sick, and the ability of that person to work within the household. What happens to someone when they have a heart attack or a stroke, and then what happens to their family? Does having chronic disease make you poor? Is one of the questions that we're trying to answer. Another set of studies that we're doing with this great opportunity from the NHLBI and United Health is looking at the burden of chronic obstructive pulmonary disorder or lung illnesses in Bangladesh. There really hasn't been a good look at measuring this in Bangladesh. And then also looking at high blood pressure in the population and getting a really good measure of that so that then we know where we stand going forward. Our hope is that by drawing attention not only to rigorous numbers, more so to raise awareness, both within the population so that people will know that they're sick, that the health system will become aware that chronic diseases are something that it can deal with and needs to deal with, but then lastly, that our global development partners will become aware that chronic disease is the biggest killer, that it is having an impact on families and on households and on women and on children, and that this is an area that's worth investing in globally. Each year we're going to bring in 6 students and we're going to train them in complex scientific methodology, but to really help them focus and develop a group of workers who are focused on chronic disease and have the skills to be future leaders of chronic disease research in Bangladesh.
And what is
Our long-term hope is that the people of Bangladesh will not only be aware of what it is that's making them sick, but also how they can prevent it. But then if they should become sick, we hope that they should live in an environment where the healthcare system is able to respond to what they need and help them manage their conditions and live healthier, happier lives.